I'm Dr. Reinhardt, Director of the Brooklyn Initiative to Develop Geriatrics Education, or BRIDGE for short. It's my pleasure to welcome you today for this session on environmental exposures in older adults, a really important topic for consideration during your clinical encounters and of mounting public health concern for older patients. This lecture is one of a series that supports the activities of the BRIDGE program, as well as our new Advanced Certificate Public Health program in Public Health Geriatrics in the School of Public Health. This talk will also be used to create an online learning module for continuing education of Brooklyn's providers. The BRIDGE program is funded by the Health Resources and Services Administration as part of the Geriatric Workforce Enhancement Program funding stream. The BRIDGE program was developed in partnership between 4 of the colleges and schools at SUNY Downstate Health Sciences University, including the College of Medicine, College of Nursing, School of Public Health, and School of Health Professions. This truly interprofessional partnership of our colleges and schools is complemented by our outstanding partners in the community, including New York City Health and Hospitals Kings County, Brownsville Multi-Service Family Health Center, and the Fort Greene Council's network of 13 senior centers throughout Brooklyn. The overall goal of the BRIDGE program is to provide the education and support needed for Brooklyn to become an age and dementia-friendly place for our senior neighbors to obtain their health care. It's my pleasure today to welcome Dr. Lori Hoepner to speak on the important topic of environmental exposures in older adults. Dr. Hoepner is Assistant Professor of Environmental and Occupational Health Sciences at SUNY Downstate Health Sciences University, School of Public Health. She received her Doctor of Public Health in Environmental Health Sciences with a concentration in molecular epidemiology from Columbia University, Mailman School of Public Health, and she holds an MPH in Maternal and Child Health from Tulane University School of Public Health and Tropical Medicine. With over 70 publications and more than 20 years of extensive public health research experience, Dr. Hoepner has researched the health effects of occupational and personal exposures from air, food sources, consumer products, and the World Trade Center tragedy. She is regularly sought by the media, industry, and public officials to provide expertise on phenols, pesticides, and most recently, the COVID-19 pandemic. Thank you, Dr. Hoepner, for joining us today. We're all looking forward to your talk.
Today, I'll be talking about environmental exposures in older adults. So this is definitely geared for both healthcare professionals and community members. And like I said, I'm an assistant professor of environmental and occupational health sciences at the School of Public Health. And today I'll be reviewing what is environmental health. So you'll get a little primer on environmental health in general, and then thinking about epidemiology, and then understanding how environmental exposures affect older adults, outcomes from environmental exposures, and I'll be talking about what that really means in terms of that population, and then discussing some considerations for clinical practice. You'll be able to define environmental health at the end of the session, identify environmental exposures in older adults, explain the relationship between environmental exposures and health outcomes in older adults, evaluate gaps in clinical care related to environmental exposure assessment in older adults. First, what is environmental health? It's a big question and big topic. But first, let's think about what is the environment. So some key terms and definitions for you. The environment is a lot of things. And whenever I ask students, what is the environment, I get a lot of different answers. Many people start thinking about or talking about greenery and nature and the outdoor air and the outdoor environment. But it's really anything that we come in contact with, right? It's the circumstances, objects, or conditions by which one is surrounded. And that's the Merriam-Webster definition. It is also to be considered about in the scientific world. So it's a variety of physical, chemical, and biotic factors that act upon an organism, in this case, in public health, the human, or an ecologic community, and ultimately determine its form and survival. And so that's really more of a general and interpretive definition of what the environment is. It gives you a little bit more detail. When we think about environmental health, though, we're thinking about what happens in the environment that will affect our health. So hazards and even non-hazards, but really a lot of times people think about it in more of a negative way. The variations that we each have, each individual, and variations from population to population, community to community. And then what do we do to minimize and protect ourselves against hazards in the environment? And that's going to change over time as well, and it's going to depend on the population or the community that we're thinking about. So environmental health is a part of public health. It's one of the cores, one of the tenets of public health. And when I think about environmental health, honestly, I think it covers everything in public health. And it really has an association, an interdisciplinary association with every other core that happens in public health. So we think about the relationships between individuals or people and their environment, how we can promote human health and well-being, and then what do we do after we think about all of that, how do we actually create a healthy environment? How do we keep communities safe? When we talk about the environment combined with the health, there's 3 factors to focus on. There's the natural environment, as I mentioned. That's usually where people start to veer towards when I ask them, what is the environment? So the natural environment, the trees, the weather, the grass, the greenery, etc. What is out there that we are experiencing when we go out into the world? Then there's the built environment, which is what we make as humans. It's the anthropogenic effect and the anthropogenic buildings and features around us. And then there's the social environment, because we can't leave out mental health, we can't leave out the psychosocial effects of the environment and our connection with other people. So the social environment is also a piece of the environment and health that we factor in. What do we study? I could probably I do spend a semester at least talking about what is studied in environmental health, and still it's only the tip of the iceberg. I could probably talk for years about what we study in environmental health and cover every topic. But just an overview, some of the top topics that are covered in environmental health. We're always talking about air quality. This is something that now is, of course, in the middle of or wherever we are in the pandemic, something that people are thinking about all the time. But in environmental health, we were thinking about it a long time ago. Water and sanitation, chemicals and radiation, or toxicology, which is a branch of environmental health. It's also practiced in clinical practice, but we think about it in environmental health as well. The built environment, which I just mentioned, which is everything that we've made and created around us that is human-made. Climate change, or some may be calling it also climate crisis, climate emergency. What is happening in terms of weather patterns and extreme temperatures? And I'll be talking about that more also. Infection control and outbreaks or epidemics or pandemics, they are indeed environmental and a concern in environmental health. And occupational health is much like toxicology. It's a branch of environmental health, or a factor in environmental health. So we, of course, have our social environment and the environment that we choose to put ourselves into, and then the occupational environment that we may not have as much control over. As a reminder, maybe, or just to point out, Healthy People 2030 has a specific goal and objective in terms of environmental health: to promote healthier environments to improve health. And those objectives are to reduce exposures. As I mentioned at the beginning, we want to reduce exposures and make healthier, safer communities. To reduce heat-related outcomes, so now we're starting to think about extreme weather and heat outcomes in terms of healthy people. And compliance with the Safe Drinking Water Act, or SDWA. And as we've seen in the past decade, there's a lot of concern about water, and we know from the Flint water crisis that there's definitely issues with potable water for us in our cities, in our urban areas, and also well water. Neighborhood and built environment is also an objective. Air and hazardous sites, toxic pollutants, and specifically in Healthy People 2030, they talk about schools. And then finally, transportation. And just like we've seen with the COVID-19 pandemic, there are issues in terms of commuting and transportation and access to transportation and reliable transportation and the health of our transportation system. So one of the goals is definitely to increase mass transit commutes, because that will reduce the burden in terms of climate change from air pollution and from vehicles on the road.